When health and wellbeing boards first became public, people felt a bit stifled perhaps by performing in front of an audience, but actually that's gone pretty quickly. And now everybody's diving in, having their say, but also making sure that the outcomes are what's best for the whole of our local population.
And there's a lot of evidence that health and wellbeing boards have established really good relationships between the organisations that are directly represented on them. There are two big questions though. The first is whether those relationships are good enough for the members of the board to have the difficult conversations that are necessary to take the prioritisation decisions they face. And secondly, there's a question in some areas about the quality of the relationship between the board and organisations not directly represented on them, especially the major health service providers, including the big acute hospitals.
I think it works well for all the members, and I think there's three reasons why we do that. Firstly, everybody was involved in setting our priorities and setting our strategy, so everybody felt involved. Secondly, I think we have the nature of the meetings that we have are such that everybody contributes. And thirdly, the chairs meet to set the agenda and to plan the work programme several months ahead, so we make sure that it's got everybody's interests on there. And of course it's easier for us in Sheffield because we've got a smaller number of partners than a lot of other health and wellbeing boards.
Two things that strike me immediately are about, one, having joint agenda setting, making sure the structure's in place to make sure the right stuff gets on the agenda of the Health and Wellbeing Board. And that engages all stakeholders. And I think stakeholders at a locality level of district councils could be better represented. So certainly from a CCG perspective, we have a good locality engagement with our practices and our public, but in fact engaging district councillors at that stage would be really valuable, and really valuable learning we could take up to the Health and Wellbeing Board and share those experiences.
I think there are two elements to this. The first is that you need a very strong shared sense of what your problems, your challenges and your opportunities are. So for us, I think we did a lot of work on that early as part of building relationships. And they were new relationships in many ways between GP leads on the one side and the local authority on the other. I think a great degree of openness is important. I think it is a learning process, particularly because for us, as for many other local authorities, our historic relationships were with the PCT. I think the great thing to do is keep in mind always what an opportunity this new set of relationships gives. This is about people who are locally accountable, the GPs on the one side, the elected members and the officers who work with them on the other. And if you can hold on to that, remember that we're both people who are locally accountable and have a responsibility for a particular area, then there's an enormous amount you can do.
I think our role is to try and enable with those partners the best environment and best influence that nationally that's possible for health and wellbeing boards to be able to do things as flexibly as they possibly can. So in other words, really enable them to have the environment where we can make as easy as possible the things that they really have to do that are very challenging. NHS England obviously has a role in terms of supporting the development of CCGs as well as its own direct commissioning within area teams, and I think it's really important that we help them to become fantastic partners, particularly around area teams themselves and their roles that they can play in health and wellbeing boards locally.
One of my messages is that people need to be more vocal, they need to be more involved, and they need to say if it's working for them or, more personally, if it isn't. And then it can change and it can adapt, and then it can deliver what we all want it to deliver.